Hi, I'm Dr. Italo Brown. I'm an emergency physician and assistant professor in social emergency medicine and chief impact officer of trap medicine.
And I'm Dr. Cedric Rutland. I'm a pulmonary and critical care physician in Southern California, a national spokesperson for the American Lung Association, and I'm an assistant clinical professor of internal medicine.
We're headed to a place that's not only integral to our communities,
But our entire souls. The
the barbershop. This is barbershop medicine.
The barbershop has been a staple and sanctuary amongst our community for decades.
Now, traditionally, barbershops were where people went for medical procedures and services.
Continuing that tradition, we travel across the country to discuss health and wellness in barbershops.
And today, we're gonna check out Jamie's barber right here in LA.
Danny,
Oh,
it's closed. Let me make a
this
call.
is what I'm talking about. COVID-19 has affected the way that we live in every way possible. Right here in LA, there have been over 1.2 million cases, and 23,000 of them have been fatal.
Where?
That's why we ask people to practice these
Yeah,
precautions.
we on the way. Hey, he's down the street. He's outside.
Oh,
He's got.
all right, cool.
Yeah, we got
Let's
it.
hit it.
Let's go. What's up, brother?
Hey, what's happening, man? What's good, What's good?
Hey, how y'all brothers doing? All right.
I'm across from you.
What's
happening, bro?
How y'all doing?
I'm good, man.
Thanks. We gotta make a point.
Well, fellas, as y'all know, the shop's closed due to COVID, but we all know that a barbershop's much more than a place you come just to get a cut. It's a
Automatic.
place where we come to fellowship, talk about our personal and social issues. So I decided we can do that anywhere. So we brought the shop outside. I brought some real medical experts out here, and we're gonna talk about why COVID's been hitting the Black and brown community so hard.
Oh, yeah. I came to the barbershop on the right day.
I know, man.
Yeah,
you did.
We sure have a whole lot of backyard conversation.
Most people want to get a haircut when things aren't going right.
Yeah.
And so not being able to do that has changed so many people's lives. I know in our communities, like, this is our country club. This is our safe space. We talk about when the Jays come out. We talk about where to take our girls for dinner. We talk about, how we're gonna name our children, but we never have conversations about our own health, both mental and physical well-being.
And I'm just one of the ones to believe that stress kills at the end of the day.
You're 100% right.
So
100%.
now, knowing that people of color, they usually in a stressful situation.
You hit that on the head, brother. That's exactly right.
Come
Facts.
on,
Keep going.
come on.
Keep going.
So knowing that they're in a stressful situation, because, not to talk about it, I'm not prejudiced or nothing like that, but, usually people with financially all right, they breathe in fresher air.
Right,
they
yeah.
go into the doctor on a regular basis. We don't go to the doctor until we just hurting about to fall out and ain't got no choice.
Enjoying this convo, talking about how COVID's affecting the Black community, and brown community, you feel me?
As an artist, how did it affect you, like, off the rip?
It's weird, man. It's like I have 100 band members underneath me.
Oh, wow.
Right? Different countries, the whole nine. So when I don't tour, I feel like all my kids weren't eating. It was weird.
Yeah.
Because I'm like, we tour like 200 days out the year.
Word.
So I feel like I have just like hundreds of people that I wish that I could do more for, since I'm like a centerpiece for a lot of their incomes.
That's real.
So that's kind of my perspective on it.
So I have a question. Having student athletes back on campus, they have a lot of questions. They're generally 18 to 22-year-olds. How, with the vaccine, can I, as an administrator, better inform, educate, and direct to experts and away from conspiracy with the vaccine?
The vaccination, we feel, is necessary. Because if we don't get the vaccination, already knowing that there are healthcare disparities and equity problems, if we don't get the vaccination, it's actually gonna widen that gap. Because if less Black people get the vaccination, that means more Black people are gonna get sick.
I got like a myth debunker I need y'all to have. Cause like on my way over here, the driver was talking about how he was through the swine flu and all these other viruses and his perspective on that. And he says back in the day, it used to take 10 years of research and study to get that for the people. And so acknowledging that we are better with technology and medicine, is it still that 10-year necessary to have a vaccine such as COVID for people?
Here's the thing about vaccines. To be able to generate or manufacture a vaccine, you have to know what the virus looks like. In other words, you have to know the construction of the virus. You have to know what coronavirus is, right? We know what it is because of the SARS-CoV-1 epidemic in China in 2003. So when you look at it, initially you're like, oh man, we got this vaccine in a year. That's not true.
It's not at all.
We knew what the spike protein looked like. It looked 90% like it looks like in SARS-CoV-1, so we already had the sequence, right? There's 7 coronaviruses that infect humans, all right? 4 of them we pass around and cause the common cold in 30% of people, all right? And they all have names, right? NL63, OC43, 229E, HK.
Ronnie, Bobby, Ricky, Mike.
Same thing. Same thing. Same thing. Ronnie, Bobby, Ricky, Mike. It's the same thing, right? And then you got 3 severe coronaviruses: MERS-CoV, SARS-CoV-1, SARS-CoV-2. Here's what's important. We all know you can't tell your mama what to do.
You can't scare somebody
You
into being
can't.
healthy.
You can't scare. Yeah, you can't be. I can't say, low down, go get vaccinated, and then turn around and bounce. Like, that's not what
I'd like to bring you guys some hydration.
man.
And I want to say, if my doctor was as handsome as you two, I'd go more often.
Hey now.
But thank you.
Come on now.
I got one.
He is.
Enjoy. I have to go back to work, but keep doing what you guys are doing.
Thank you so much. Thank you.
Appreciate you. I have a real problem with the way the messaging is going on with this vaccine. I think it's very counterintuitive. I understand as medical professionals, right, not to put you guys in any kind of box or anything like that, but you're gonna see things from a certain perspective. And from our perspective, again, what's the point for a young man of my age to take a vaccine if they're still gonna make me wear a mask, if everything's still gonna be at half capacity? I think that's the worst part of the messaging that's going on. I think the biggest thing you should be drilling in people's head is if you wanna get back to normal, take the vaccine.
I always called it a pandemic. I ain't even called it a pandemic, a pandemic.
No, please. You gotta have to qualify that a little
please,
bit, man. You
please.
can't just throw that out there.
Yeah, I gotta get it.
I just feel like it was a plan. I don't feel like nothing just happened per se overnight. Now, I just feel like it was a plan. And me, I'm somebody that read a lot of history. So I feel like if you don't know what it was, you don't understand what it is. So you're ill prepared for what is yet to come. So looking at history and how we've been done, and then how they put the wraps on stuff for 25 years, by the time we got somebody ready to fight, some of our militant kids or something like that, the people that's really was involved in it's kind of like dead, gone, older, don't really have that fight. So then just knowing y'all got them kind of wraps on it, government-wise and stuff like that, I'm still questioning.
Hold up. See, we can't just glaze over this. We really have to unpack this issue. There is a long history of medical mistrust between communities of color and the medical complex. And I'm talking decades. Like, think back to the 1800s. The name James Marion Sims, many know him as the father of OBGYN. But he was experimenting on black bodies. Many of them weren't given anesthesia when he was performing these procedures that we still do today. And it's rooted in the belief that black women didn't feel pain. But in the 1800s, they were going to black grave sites and robbing them of cadavers to train the students. The 1900s, most people are familiar with the Tuskegee syphilis study. This is one that you probably have heard more commonly now that we're talking about vaccination. However, in this one, black men in the South were actually withheld the treatment as they studied the natural disease course of syphilis. And then in the 1960s, there were the radiation experiments held in both Pennsylvania and Ohio, where inmates were test subjects. See, this isn't anything new. This mistrust is deep. And you can follow people like Dr. Essien who talk about this constantly to understand it a little bit better. For now, let's just jump back into this conversation. I have a good relationship with my dad. It took me so much energy to try to convince him not to be skeptical about the vaccine. My dad's out of the 60s, you know. His brother's from Saginaw, Michigan. Same place as Venus and Serena, same place as Draymond Green, same place as Stevie Wonder. That's what my dad comes from. Blue-collar worker, you know, and he don't take no mess from nobody. So talking to him about health is already a struggle, and his son is a doctor. You know what I mean? Like, I'm talking to this dude about his own health. So when COVID came and trying to send him N95 masks through the mail, literally telling him, don't come visit your son. I might be the one that's carrying the virus. I don't want you to see me. You know, these conversations were tough. Getting down to the vaccine and then hearing all the times the healthcare system failed him made him skeptical. But I slowly chipped away at it. And what I learned about for brothers who are of my dad's generation, it takes time, It takes persistence. You can't give up after one message. You bring the science, you ask and listen. So I'm gonna listen to you when you say, these are the reasons why I don't trust the vaccine. And take me as deep as you're ready to go. I'm talking Jacques Cousteau. Like, go as deep as you possibly can so that I can come back and then fill those gaps of knowledge.
Right.
And then support you. And then justify the fact that you feel the way that you do and it's okay. That builds a trust relationship. And on the strength of me and my dad's relationship, he took a risk on getting the vaccine. Unfortunately, he got COVID before he could get the vaccine. That's the reality I don't want other people to face, is where it takes so much time to get that stuff through that eventually it happens.
But what about the pre-existing conditions that affect Black and brown people in particular, and why they affect us versus those other communities?
Pause. Let's get into that a little bit. These walls have been serving the Black and brown population since the late 60s. And that's what we're here to have a discussion about. We're gonna talk about disparities. We're gonna talk about how COVID-19 has impacted the Black community. And we're gonna talk about that right now. Dr. Odunya, thanks for having us.
It's a pleasure to have you, Doc.
I really appreciate being here. I think it's important to have a discussion around healthcare disparity and minorities and the impact of COVID-19 on our community.
Right. You said one of the key words, disparities. And when the vaccines became available, we were the last ones to receive them. When you see that 35% of the Caucasian community has already received vaccines compared to 4% of the Latino and 3.5% of the African American communities, they throw money at the issue. Everybody talks about it, but the resources are lacking.
Why do you think that the Black and brown population has hypertension, diabetes, obesity, even COPD and things like that? What do you think is contributing?
We're treating the symptoms and not the cause of the problem, which is the conditions that we live in. We're surrounded by fast food establishments, and we don't eat properly, and which contribute to the diabetes or the clogging of the arteries and asthma, COPD, things that you are very familiar with and that you work with, you see on a daily basis.
The concept of acquiring these pre-existing conditions, it's not that they're built in our genetics.
Correct.
There's no gene for obesity. It's more of we're gonna go get what we have access to and what we can afford.
Right.
Right?
Right.
And so much so it even makes me think of access to health care.
That's so true, and that's what the federally qualified health centers like Central Neighborhood is all about.
Yeah.
We're the safety net. We practice preventive medicine. However, as you said, hey, if I have a choice of going and seeing the doctor about my headache or toothache or go to work and make a few dollars, I'm going to work.
Right.
I'll just ride the headache out.
Yeah.
And not knowing that it might be symptomatic of something very serious.
I wasn't at the spectrum of the 5G conspiracy, zombie thing, but I was just like, I didn't know. You remember the 2 years situation where I felt like it happened too fast with the solution.
Yeah.
And so that's what made me doubt it. But the fact that you educated me on actually what was happening, I'm cool with it. And I feel like this whole pandemic put me in a situation where my money couldn't solve my family's health issues, which hurt me the deepest.
Yeah, that is.
Because if I could buy them life and health, for sure.
Yeah.
Take all this, I don't care. But it was like to say that, because I lost my grandmother to COVID.
Sorry to hear that.
Oh, man, bro.
And it was like, as a man that likes to really fix things. I mean, we men, we like to fix, build, naturally, biology. I couldn't do nothing. I couldn't see her. I couldn't help. And I was like, man. So when the vaccine came out, I was like, I want to educate myself because I want to want this. And I want to get this for people that are under me and in my reach. So yeah, after y'all's education, I'll definitely tell it to more people as well because y'all know what y'all talking about.
Y'all put me closer to wanting to do it than I felt before I had this conversation. I know people that have passed away from it, but I can say me, myself, personally, I'm closer now to doing it than I was before. I'm hearing it clear, I'm understanding, not no drive-by conversation on the news and not really knowing what all them words mean and getting off. It makes more sense right now having this intimate conversation for me.
The thing with the vaccine was that I wasn't in opposition to it. I just wanted to see kind of like what happens first.
Right.
Like, that was kind of selfish of me. And from what I understand, even if I might not be in any risk factor of dying from this disease, maybe somebody else might be. And me getting this vaccine might make sure that it can keep them healthy. So if my number comes up to get the vaccine, I'll be on my way to get it.
The more you do it, you unlock his ability to do it. You liberate him to do it. You get this man on point. And then at the end of the day, we just use each other as a support system to have these conversations because no one's gonna pull us aside and talk about this.
So this is exactly why I wanted to get you guys together. This is a place of real talk. You feel me? I got my brothers here, talking about real life issues and what's happening to us right now. And I really thank you guys for coming.
I appreciate y'all.
Appreciate it.
I'm gonna lean on you, dog.
This we do and try and go.